Let's get into it. Number 10. Foreign Accent Syndrome. Imagine waking after a stroke and suddenly sounding like someone from another country. Foreign Accent Syndrome changes speech patterns without teaching anyone a new foreign accent. The person still speaks their normal language and remembers exactly what words mean. But rhythm, pronunciation, stress, and tongue movements may shift in noticeable ways afterward. Listeners can interpret those changes as French, British, Korean, or another familiar accent. The speaker did not learn that accent and often cannot consciously reproduce it. Neurological cases usually follow strokes, brain injuries, or other damage affecting speech networks. Some cases also appear without obvious structural injury, involving functional neurological changes instead. Functional means brain activity changes even when scans show no clear physical damage. The syndrome can affect identity because a familiar voice suddenly feels strangely unfamiliar. People may repeatedly explain that they are not pretending or performing for attention. Speech therapy sometimes helps patients recover more familiar patterns after neurological injury gradually. Recovery depends on the cause, severity, and exact brain systems affected by damage. Doctors first described this strange speech phenomenon more than a century ago medically. Modern brain imaging has improved understanding, but the syndrome remains exceptionally unusual today. Your brain never learns another country. It simply changes how familiar speech sounds. Number 9. Cotard Syndrome. Cotard Syndrome can make living people sincerely believe they are already completely dead. Some patients believe their bodies disappeared, their organs vanished, or they stopped existing. Others become convinced they are immortal because dying supposedly already happened to them. These beliefs are called nihilistic delusions, meaning existence itself feels absent or destroyed. The condition usually appears alongside severe depression, psychosis, or certain neurological illnesses sometimes. It is far beyond ordinary sadness, emptiness, hopelessness, or feeling emotionally disconnected inside. A person may reject clear evidence because the delusion feels completely undeniable to them. Some patients even stop eating because they believe dead people require no food. That can quickly cause dehydration, malnutrition, weakness, and additional dangerous medical complications afterward. French neurologist Jules Cotard described similar cases during the late 19th century clinically. Doctors now focus treatment on whatever psychiatric or neurological condition is causing symptoms. Medication can help some patients, depending on the underlying illness and individual presentation. Severe cases have sometimes improved after carefully controlled electroconvulsive therapy, called ECT medically. ECT uses electrical stimulation under anesthesia to change brain activity in controlled conditions. Modern ECT looks nothing like the frightening, uncontrolled versions shown in old movies. Cotard Syndrome proves your brain can question something as basic as being alive. Number 8. Aquagenic Urticaria. Aquagenic urticaria is often called water allergy, although that description is technically misleading. Water touching the skin can trigger itchy hives, burning, redness, and swelling quickly. The reaction can follow showers, swimming, rain, sweat, or even someone's own tears. Temperature usually does not matter, unlike another condition triggered specifically by cold water. Urticaria simply means hives, those raised, itchy welts appearing across irritated human skin. Symptoms often begin within minutes and gradually disappear after the water exposure ends. That makes showers, exercise, rainy weather, and ordinary sweating surprisingly complicated daily activities. Researchers still do not fully understand why water causes these unusual skin reactions. One idea involves water interacting with skin substances and triggering inflammatory chemical release. Doctors can investigate suspected cases using a controlled water test on the skin. Antihistamines often reduce symptoms by blocking chemicals involved in the body's inflammatory response. Other treatments may be considered when standard antihistamines fail to control reactions sufficiently. Completely avoiding water is impossible because human bodies depend on it for survival. Management, therefore, focuses on reducing contact problems while controlling symptoms as safely possible. The condition is extremely uncommon, which also makes large scientific studies difficult currently. Imagine planning every shower because the world's most ordinary liquid attacks your skin. Number 7. Epidermodysplasia Verruciformis. Epidermodysplasia Verruciformis sounds invented, but it describes a very real, rare skin disorder. The enormous name refers to unusual susceptibility toward particular types of human papillomavirus. Human papillomavirus, shortened to HPV, is actually a large family of common viruses. Most people control many skin HPV types without developing anything remotely tree-like afterward. These patients have immune problems that allow certain HPV infections to persist unusually. That can produce widespread flatwarts, scaly patches, and sometimes dramatic skin growths. Severe cases may develop thick, clustered lesions that visually resemble rough tree bark. Those extreme appearances created the famous nickname Tree Man Syndrome across popular media. However, not every patient develops enormous branch-like growths on hands or feet everywhere. The condition also increases the risk of certain skin cancers over someone's lifetime. Sun-exposed skin becomes especially important because ultraviolet radiation can raise that risk further. Treatment can involve surgery, skin medicines, careful monitoring, and strong sun protection measures. Large growths may return after removal because the underlying susceptibility still remains present. Some inherited forms involve genes responsible for controlling the skin's defense against HPV. Other acquired forms can appear when someone's immune system becomes severely weakened later. The real problem is not becoming a tree, but losing control over HPV. Before continuing, one quick favor genuinely helps keep this channel researching properly today. Rare medical stories spread online because shocking claims travel faster than careful corrections. Checking medical papers takes far longer than repeating whichever viral post appears first, but the verified versions usually remain strange enough without inventing extra frightening details. If you watch this far, please support that effort by subscribing right now. Not a comment, not a share, and definitely not some complicated membership either. Just press subscribe because that single click keeps properly researched stories coming here. We will keep checking the medicine while still making every strange detail entertaining. Okay, subscription guilt completed, so let us return to medical conditions sounding impossible. Number 6. Fibrodysplasia Ossificans Progressiva. Fibrodysplasia Ossificans Progressiva is better known by the dramatic nickname Stone Man Syndrome. Despite that nickname, patients are not literally transforming into stone over time physically. Instead, their bodies gradually form real bone inside muscles and connective tissues elsewhere. Connective tissue includes structures like tendons and ligaments supporting movement throughout the body. Most classic cases involve changes affecting a gene called ACVR1 from early development. That gene helps control signals telling the body when new bone should form. In FOP, those signals become dangerously active where bone absolutely should not exist. Painful flare-ups can trigger extra bone after injuries, injections, falls, or illnesses sometimes. Even surgery intended to remove unwanted bone may cause additional bone formation afterward. Many affected babies are born with unusually shaped or shortened big toes already. Over time, extra bone can lock joints and progressively restrict normal body movement. The neck, shoulders, back, hips, jaw, and limbs can become increasingly rigid gradually. Doctors therefore avoid unnecessary injuries and procedures that might trigger new flare-ups whenever possible. Treatment can manage certain complications, but the condition currently has no complete cure. The frightening part is the body's healing machinery behaving far too aggressively instead. A minor injury can tell someone's body to build bone in completely wrong places. Number 5. Alien Hand Syndrome. Alien hand syndrome can make one hand behave as though someone else controls it. The affected limb performs purposeful movements without the person consciously deciding to move. It may grab nearby objects, touch surfaces, or interfere with the other hand. Some patients describe the limb as unfamiliar, foreign, or somehow outside their control. The hand is not possessed, although the experience can understandably feel almost supernatural. Instead, damage disrupts brain networks connecting movement, intention, awareness, and voluntary control. Alien hand can appear after strokes, brain surgery, injuries, or degenerative disease sometimes. Different affected brain regions can produce noticeably different patterns of unwanted movement behavior. One hand may grasp nearby objects and stubbornly refuse to release them afterward. Another might undo buttons immediately after the opposite hand carefully fastens them closed. That conflict can make dressing, eating, carrying objects, and daily tasks frustrating. Patients usually understand the movements physically belong to their own attached limbs still. What disappears is authorship, meaning the feeling that you intentionally caused movement yourself. Treatment usually targets the underlying condition while teaching practical strategies for control. Some patients keep the troublesome hand occupied by holding objects during activities deliberately. Your own hand remains attached while its actions suddenly stop feeling entirely yours. Number 4. Capgras Syndrome. Capgras Syndrome can make someone you love suddenly seem like a perfect imposter. A patient may believe their spouse, parent, friend, caregiver, or pet was replaced. The supposed replacement looks identical, yet somehow feels emotionally wrong or strangely unfamiliar. That mismatch can become an unshakable belief that somebody created a convincing duplicate. Doctors call this a delusional misidentification syndrome, meaning familiar identity becomes distorted. Capgras can appear with schizophrenia, dementia, brain injuries, and other neurological conditions. Researchers have studied disrupted brain systems involved in face recognition and emotional familiarity. Normally, seeing someone loved creates recognition alongside an automatic feeling of familiarity inside. When that emotional response becomes disrupted, the familiar face may suddenly feel suspicious. That explanation does not solve every case, because Capgras probably has multiple causes. The delusion can sometimes involve animals, familiar places, or even ordinary personal objects. Imagine seeing your mother's exact face while believing another person perfectly copied her. Arguments rarely work because fixed delusions do not behave like ordinary reasonable doubts. Treatment focuses on the underlying illness while protecting patients and people around them. Caregivers may use calm reassurance instead of constantly challenging the belief directly themselves. The face remains familiar, but the emotional certainty behind recognition somehow breaks apart. Number 3. Exploding head syndrome. Exploding head syndrome has possibly the most alarming harmless name in sleep medicine. Thankfully, nothing actually explodes, and the episodes do not physically damage your brain. People suddenly perceive extremely loud noises while falling asleep or waking from sleep. The sound may resemble gunshots, explosions, thunder, crashing cymbals, or slamming doors nearby. Some people also experience sudden flashes of light during these startling episodes sometimes. Doctors classify it as a parasomnia, meaning an unusual event occurring around sleep. The episodes usually last only moments and are generally painless despite intense fear. That sudden shock can still cause racing heartbeats, anxiety, and trouble sleeping afterward. Researchers do not fully understand exactly why the brain creates these sensory explosions. One theory involves sleep transition activity briefly becoming poorly coordinated across different brain systems. Stress, insomnia, and other sleep experiences may be associated with episodes for some. Many sufferers initially fear strokes, seizures, brain bleeding, or actual external explosions nearby. Learning the diagnosis can therefore provide enormous relief after dangerous causes are excluded. Treatment usually emphasizes reassurance, healthier sleep, and managing related sleep problems properly. Medication is sometimes considered for frequent troublesome episodes, although evidence remains limited overall. Your room stays silent while your brain provides an extremely convincing sound effect. The syndrome sounds lethal, but researchers generally classify isolated episodes as benign events. Number 2. Morgellons. Morgellons is easily the most controversial condition included anywhere on this particular list. People report crawling, biting, stinging sensations, and unusual fibers around skin lesions repeatedly. Those sensations can feel intensely physical and cause genuine distress for affected people. The controversy concerns their cause, not whether patients are experiencing real suffering daily. Some sufferers believe an infectious process creates mysterious fibers emerging beneath their skin. A major United States investigation examined reported lesions, fibers, symptoms, and possible exposures. Researchers found no common infection or environmental cause explaining the reported condition overall. Many collected fibers were cellulose, a material commonly found in cotton and clothing. Medical reviews often place similar presentations within delusional infestation or related psychiatric conditions. That means someone sincerely believes unwanted organisms or materials occupy their body surface. Calling beliefs delusional does not mean discomfort, wounds, or distress are somehow imaginary. Repeated scratching and attempts at fiber removal can create genuine injuries and infection. Doctors therefore need compassion while investigating other causes and treating symptoms carefully too. The internet often presents Morgellons as an infection medicine stubbornly refuses to acknowledge. Current evidence does not support that simple infectious explanation, despite continued disagreement online. The symptoms deserve treatment even when patients and doctors disagree about their origin. Morgellons shows how medical uncertainty can become even harder when trust breaks down. Number 1. Pica. Pica is an eating disorder involving persistent consumption of things that are not food. People may eat dirt, clay, paper, chalk, hair, soap, or other substances. Others consume paint chips, fabric, metal, stones, starch, or even cigarette ashes. Diagnosis requires behavior lasting beyond what would normally be expected for someone's development. It also cannot simply reflect a culturally accepted practice involving non-food substances either. Pica appears especially in childhood, pregnancy, and some developmental or psychiatric conditions sometimes. Iron deficiency has a strong association with pica, particularly among some pregnant patients. However, doctors cannot assume every unusual craving automatically proves someone lacks iron. The danger depends greatly on which substance someone repeatedly places inside their body. paint chips can cause lead poisoning, while swallowed objects can block intestines completely. Contaminated soil can expose someone to parasites, bacteria, or harmful environmental chemicals too. Sharp materials may damage teeth, tear tissues, or cause dangerous internal injuries. Doctors investigate nutritional deficiencies, developmental factors, pregnancy, and possible complications during evaluation. Treatment depends on the cause and may include nutritional or behavioral support approaches. The condition is not simply somebody enjoying an unusual snack once for curiosity. It involves persistent behavior serious enough to create significant medical consequences for people. Your brain can genuinely crave something your digestive system never expected to receive. So there you have it, 10 medical conditions that sound completely invented initially. Which condition surprised you most after hearing what the medical evidence actually says? And which one would frighten you most if symptoms suddenly appeared tomorrow morning? Tell us your answer below because we genuinely want to hear your thoughts. If you enjoyed the video, hit like and subscribe to our channel today. Turn on notifications so you never miss another unbelievable piece of medical reality. Thanks for watching, and we will see you again in the next one.